Hello, my name is Brian Casey. I'm editor-in-chief of AntMini.com, and we are here at the RSNA's Spotlight Course, Radiology in the Age of AI. We're here with Dr. Charles Kahn. He is with the University of Pennsylvania, and he is also editor-in-chief of the new journal, Radiology Artificial Intelligence. Dr. Kahn, thanks for being with us today.
My pleasure, Brian. Thank you.
Yeah. So you spoke today at today's course, and you focused mostly on current applications of artificial intelligence and different things that you see out there happening. What sort of things do you think are most exciting?
Well, the AI has an opportunity to actually have an impact throughout all the activities that we have in radiology. Everything from selecting the imaging procedure, generating the images, identifying findings within those images, helping guide the radiologist to a diagnosis, and communicating that information back. I think certainly there's been a lot of interest and a lot of work in the computer vision piece of it, being able to identify findings like pneumonia or being able to do categorization of things like bone age and other things on imaging. I think one of the areas that personally may actually have a greater impact on radiology practice and may come to the fore sooner in many ways are some of the non-imaging applications, using these systems to aid in protocoling, using the systems to aid in exam triage and to help with so-called hanging protocols, the way that images are displayed on a PACS system, for example, to save the radiologist the time of having to arrange the images, having some of that automated. I think these are some things that may actually get into practice sooner than some of the image-based challenges.
Right. Now, there are challenges to the implementation of AI, as we learned in today's talks, and you gave a really good example of an AI algorithm that was trying to analyze pleural effusion, I believe, or pneumonia.
Yeah.
And it generated a heat map, and the heat map ended up focusing on the shoulder. And why did that happen?
So one of the challenges, and the benefit of machine learning algorithms is that they're great at learning. They see patterns, they figure out patterns and what works. The problem is we don't always know what it is that they're learning. And in the case of the example that I showed, when you ask the machine learning system in the best way that we can, what is it, what are the features of this image that allow you to make a diagnosis as to whether this patient has pneumonia or not, the system focused on the letter L, the radiographic marker that appeared in a corner of the film overlying the shoulder. And it's because in one hospital where they had 30% of the patients roughly with pneumonia, the letter L looked one way, and the L marker that they used at the other hospital with very few cases. So despite the fact that the machine was learning pneumonia, or we thought it was learning pneumonia, what in fact it was actually learning was the secret was the shape of the little radiographic lead marker that appeared in the corner of the film. So the reason that I point up examples like this is that as we begin to implement these systems, it's really crucial for us as physicians and for the developers of these systems to evaluate them carefully and thoroughly. And for us, whenever we would take a system like that on board, we have to make sure that it's actually working and that we believe the output of such systems. The challenge for all of us is, we as humans make decisions, and we, in general, we think we can explain them. If I showed you an exam and I said, I think this is pneumonia, you would probably believe me. But what is it that makes me say that? I'm a bit of a black box too. I mean, you can't see inside all the neurons of my brain as to why I'm making that as a judgment. But you hope that because of experience and having been tested and board certified and all of those sorts of things that I have some satisfactory understanding of the domain. The challenge is with these algorithms, they haven't been board certified. They have, we're just in the process now of understanding what the testing process is and recognizing that even an algorithm that works perfectly in one setting, if you change some of the factors, if it's based on CT data and you change the reconstruction kernel, you change the slice thickness, you put it on a different manufacturer machine, it may not function with that same level of accuracy that the initial system had.
Yeah, excellent. So to shift gears a little bit, earlier this year, Radiology Artificial Intelligence Journal launched. Congratulations, you're
you.
the editor-in-chief of that.
Thank
And
you.
so how are things going with that journal?
It's been going remarkably well. So the RSNA launched Radiology AI as one of 3 new journals actually this year. There's one for cardiothoracic imaging, one for imaging cancer as well. We publish online bi-monthly. We just published our 3rd issue. The mission that was given to us and where we really are focused is on providing the same quality of science, the same rigor and of scientific research that is found in the Gray Journal, is found in Radiology, the main journal. So the RSNA members have access to this Radiology AI journal as a member benefit. Okay. And to date, we've published a number of really superb scientific articles and as well some nice opinion pieces as well.
Very good. So all of our members out there definitely look into that. It's a really an excellent resource for learning about AI and where it's going to be taking radiology in the future.
Yeah, our hope is that it really provides the scientific grounding. There's a lot of hype. There's a lot of there's been tremendous emotion around the introduction of AI into radiology. It's equally important that we have a really solid scientific understanding of what works, what doesn't work, and for all of these techniques and approaches people are bringing forward, that we know that they're applying sound scientific methods to assure the community that these things are going to help us and improve practice into the future.
Very good. Well, thanks for being with us today.
It was a pleasure. Thank you, Brian.
Sure. Signing off for AntMini.com, my name is Brian Casey.